D1 receptor. D1 receptor causes relaxation of kidney blood vessels, which improves blood flow to the kidneys. In the brain, D1 activates the direct pathway in the striatum, which helps start movement. Nat USMLE Question 1. A patient is given low-dose dopamine infusion for treatment of shock. Which of the following effects is most likely mediated by D1 receptor activation? A. Decreased urine output. B. Increased blood flow to the kidneys. C. Bronchial smooth muscle relaxation. D. Vasoconstriction of renal arteries. E. Reduced cardiac contractility. Correct answer B. Increased blood flow to the kidneys. Explanation: D1 receptors in the renal vasculature cause vasodilation, which increases renal perfusion and helps maintain urine output. A. Decreased urine output. D1 increases kidney blood flow, which usually supports urine output. C. Bronchial smooth muscle relaxation. This is due to beta-2 receptors, not dopamine. Vasoconstriction of renal arteries, opposite effect of D1. D1 causes vasodilation. E. Reduced cardiac contractility. Dopamine at higher doses activates beta-1, increasing contractility. D1 has no direct effect on the heart. USMLE Question 2. Which of the following best describes the function of dopamine D1 receptor activation in the basal ganglia? A. Inhibits movement by stimulating the indirect pathway. B. Stimulates movement by activating the direct pathway. C. Causes tremor by blocking the substantia nigra. D. Increases muscle tone via spinal reflexes. E. Decreases motor activity by acting on the cerebellum. Correct answer B. Stimulates movement by activating the direct pathway. Explanation: D1 receptors in the striatum help activate the direct pathway, which promotes voluntary movement. This is important in the context of disorders like Parkinson's disease, where dopamine loss reduces movement. A. Inhibits movement by stimulating the indirect pathway. That's D2, not D1. C. Causes tremor by blocking the substantia nigra. Tremor is a symptom of dopaminergic loss, not stimulation. D. Increases muscle tone via spinal reflexes, not a function of D1 receptors. E. Decreases motor activity by acting on the cerebellum. Dopamine primarily works in the basal ganglia, not cerebellum. Would you like to continue with D2?